Hey, welcome to our video series, Women's Health Matters. I'm Dr. Obi. Today, I'll be looking at the subject or topic some of you have requested that I look into, and that is weight loss medication and the possible things to consider. When we talk about weight loss medication, there are two major or classes of medication that are commonly used. The first one is the GLP-1, that's glucagon-like peptide, and the second one is the biguanides. That's, for example, metformin. Now, these medications are primarily used for type 2 diabetes and sometimes also to reduce the risk of cardiovascular or renal diseases. And then over time, it is, come to the realization that these medications have a positive side effect, which is weight loss. With time, in the recent past, the weight loss side of it seemed to have gained popularity, especially when celebrities and social media pushed this medication to the forefront. It's useful for weight loss. However, there are things to consider when you are thinking about going on them or you're already on them. The very first thing to consider is that some studies have shown that these medications can cause muscle mass reduction. Which means that the weight loss, the weight you're losing is not just the body fat, it's also the muscle mass, right? And if you're losing the muscle mass, it means then that you might start having problems, weaknesses in some of your muscles, especially the muscle that carry your weight. You might have problems, weakness in those muscles. So if you're then on this medication or considering it, make sure that you're under the care or supervision of a healthcare professional and ensure that you are combining the medication with lifestyle change. For example, increasing your protein intake. Some people have said, can I just use protein shake? No, you need to have protein to replace the protein you're losing. And in addition to that, you also need to regularly engage in resistance training exercises so they can tone those muscles. The muscles can be strong and healthy. The second thing that you need to consider is some other studies have shown that these medications is also associated with bone density reduction. If there's a bone density reduction, it means that there's increased risk of fracture, especially for people who are a little bit older people. As you grow older, the bone density reduces, right? This might make it a little bit worse than it is. So if you are then on this medication, ensure that you attend regularly to see your healthcare professionals so that your calcium level can be measured, the vitamin D level can be measured, and if it is low, you will be placed on these minerals to be able to help you maintain the density of your bones and prevent the risk of fracture. The third thing that we need to consider is vitamin B12. This is a super duper vitamin. The reason being, this vitamin is so important for your nerves, your nervous system, the myelin sheath, that is the coat that covers your nerves. Vitamin B12 is so essential in the formation. And so if there's a deficiency of this vitamin, you could start developing neurological problems, including memory loss, balance issues, mental health, some form of mental health, anxiety and all that, it could start developing those problems. It's also very important in red blood cell formation. So it means that you could also develop anemia. It's needed for energy production, vitamin B12. So if it's low, you develop fatigue, tiredness, you just lethargy, right? It's also important for your heart. It's important for your bone density. So you can see how powerful this vitamin B12 is for you. So you need to regularly check your vitamin B12 to ensure that you're not deficient in them, and start gradually over time developing other issues that are all apparently unrelated, but somehow related. So you need to continue to look at that. Then the next one is, some studies have also looked at the issue of growth problems, especially with young people. Between age of 12 or so to 18 or younger, 18 and under, because the growth is still going on. This medication, if your child is on this medication, they need to be monitored, cared for, so that the GP or your healthcare professional will be able to weigh the cost and benefit of being on them, right, on regular basis. The last but not the least is the issue of eating disorder. We are very much aware that these medications are doing the weight loss job as long as you're on them. When you come off them and you're not, maintaining a lifestyle that enables you to keep the weight off, people have gradually gained those weight back. That brings some form of anxiety for people, and then they push them into body dysmorphia or eating disorder because they feel, I got attention, I got recognition when I was this weight. Now I am this weight. I look ugly. I am this, especially young people. Now we have to bear in mind that it is not a wonder drug in that sense. I take it and then my life is changed. It's a lifestyle change that needs to be done alongside this medication for you to get the most benefit of it as it is. But it's not over-the-counter medication. So please do not go to the internet and go and see if you can scout for one and have it. Possibly you could, but you can see list of things that can possibly go wrong if you're trying to do these things all by yourself without a healthcare professional overseeing what you're doing. Women's health matters. Look after yourself. If you need to be on this medication for different reasons, please do that alongside your healthcare professional. Take care of yourself, and I'll speak to you in my next video. Bye. Bye.